Welcome to This Explainer. When it comes to large language models, medical questions present some of the absolute highest stakes challenges out there. Today, we're unpacking a massive leap forward in the AI news space. We're looking at how OpenAI's newly deployed GPT 5.5 instant model is radically transforming the safety and accuracy of ChatGPT's health intelligence, literally rewiring the system's architecture from the ground up. Let's jump right into our roadmap for today. We'll be looking at 1. The ChatGPT health upgrade. 2. Architecting for medical safety. 3. Handling uncertainty and urgency. And finally, 4. Privacy, routing, and limitations.
Section 1. The ChatGPT health upgrade.
So every single week, over 230 million people worldwide turn to ChatGPT with their health and wellness questions. Really think about that volume for a second. That is millions of people trying to decipher a scary late-night symptom or a confusing lab result. And at that massive scale, you absolutely cannot have an AI hallucinating or giving poor advice. It's just not an option. To handle this huge demand, OpenAI rolled out GPT 5.5 Instant, and it yielded an immediate, staggering result. We're talking about a 71% drop in responses containing factuality issues, and that happened over just 2 months. This update essentially brings the model's safety on really challenging health benchmarks right up to the level of frontier-thinking models. A total game changer. But, that 71% plunge in errors didn't just happen overnight. It was the result of an immense human effort. Over the course of 2 years, more than 260 physicians from around 60 different countries contributed over 600,000 individual evaluation points. This massive physician-led feedback loop directly shaped the strict output filtering that GPT 5.5 Instant uses today.
Section 2. Architecting for medical safety.
So to prioritize safety over raw speed, OpenAI did something really interesting. They deliberately separated health queries away from the standard conversational pipeline. When you ask a medical question now, it gets diverted down a dedicated, heavily guarded evaluation path. This specific path enforces far stricter uncertainty bounds and actually forces context gathering before it even generates a response.
By doing this, the dedicated path specifically targets 4 really dangerous failure modes. In the past, models might miss an urgent red flag or answer without asking for vital context. They might sound way too confident about what's essentially a guess, or just bury the user in incredibly dense medical jargon. By tackling these 4 areas directly, the system severely cuts down on hallucination rates when clinical info is missing.
Section 3. Handling uncertainty and urgency.
So, how exactly does the model behave now when you ask it a complex, maybe ambiguous medical question? Well, the short answer is it doesn't guess. Instead, it triggers 3 highly distinct response behaviors that are specifically designed to keep you safe. Let's break those down.
The first behavior is urgency recognition. The system actively scans your prompt for red flag symptoms. And if it spots them, it drops the chatty conversational flow entirely. It will literally interrupt the dialogue to explicitly tell you to seek immediate medical attention. No hesitations.
The second behavior is context gathering. Instead of just guessing what a vague symptom might mean, the model hits the brakes and asks you targeted follow-up questions. It'll ask things like, how long have you felt this, or how severe is it? The advice it gives remains strictly conditional until you actually provide enough medical context. And the third behavior is uncertainty framing. The model is explicitly trained to avoid binary black and white certainty when it's dealing with your health. It relies heavily on probabilistic language, it cites confidence ranges, and it clearly flags any speculative info. It will absolutely never sound overconfident about uncertain data.
It's also really cool to see how the system filters the complexity of the responses. Dense medical jargon is translated into plain, readable language, but without losing any of its clinical accuracy. And if you simply don't have enough specific information to give it, the architecture acts more like a compass. It defaults to broad, scenario-based guidance rather than giving you definitive advice. Section 4. Privacy, routing, and limitations. Now, obviously, privacy is paramount here. Under the Health Data Isolation Protocol, your conversations are locked away from the standard memory pipeline. Think of it like a vault. Your health queries will not influence your future non-health chats, and they are never, ever used to train general model weights. And this isn't just a surface-level promise either. It's hard-coded deep at the routing layer. Actually, a quick but absolutely crucial note for any developers out there integrating health-aware agents. That 71% improvement in factuality applies specifically to OpenAI's internal framework. You can't just plug in the base model and walk away. You still have to build your own explicit validation layers to meet your specific jurisdiction's medical regulations and liability boundaries.
This brings us to the ultimate limitation and a very hard boundary. The model is not a diagnostic tool. Period. It does not replace a doctor, it cannot write prescriptions, and it is never a substitute for emergency care. Production monitoring continuously flags outputs that omit this disclaimer, ensuring users treat these outputs purely as informational summaries.
So GPT 5.5 Instant is an incredible leap forward for those 230 million weekly users. But it leaves us with this final, somewhat provocative thought. As these AI models achieve true frontier-level intelligence in medicine, the lines are inevitably going to blur. How will we as a society continually enforce that critical boundary between a highly capable informational summary and actual clinical care? It's a huge challenge we're all going to have to navigate together. Thanks so much for joining me for this explainer, and definitely check out the official documentation to dive deeper.